Everybody, it's likely that during this broadcast, someone in the tri-state will overdose on heroin and perhaps die. The drug is killing 8 people a day in the state of Ohio.
And the state health department says more than 3,000 people died from overdoses last year. That's the most ever in any single year and a 20% jump from 2014. Now, heroin was responsible for nearly 50% of those deaths. But it is the painkiller fentanyl that's causing the most concern. It killed 1,100 people last year, twice as many as the year before, 14 times as many as in 2013. And nowhere is it worse than in Hamilton County, where 195 people died last year from a fentanyl-related overdose.
The crisis is prompting county leaders to call for change. They say enough is enough. Local 12's Anjanette Levy kicks off our team coverage tonight with what they're doing to try to get the drugs off the street. Anjanette.
Well, Rob, a group of leaders in the fight against the heroin epidemic gathered here at the sheriff's office this afternoon. They say after so many overdoses, it's time to expand a program that's working in at least one community.
It's unlike anything we've seen before.
At least 78 overdoses since Monday. 3 people have died. The runs for overdoses have taxed first responders.
We're here to assure the public we recognize this is an emergency. Everyone recognizes that based upon what we've seen over the weekend, but I can tell you with all frankness that the coalition has seen this progress. And the spike in overdoses, unfortunately, is not a surprise to us.
Hamilton County Commissioner Dennis Deters says the county will expand heroin response teams. 2 currently exist in Colerain Township and Norwood. Deters credits Colerain's team with helping reduce overdoses by 35% in that community. A police officer, an EMT, and an addiction services specialist visit a person who overdosed and explain their options for getting into rehab.
That's our goal, is to get the current population into recovery and keep them there and to stop a whole generation from even getting started.
It's part of a strategy to reduce the demand for heroin. Meanwhile, an investigation is underway to find the dealers.
There's clearly a batch of who knows what, heroin, fentanyl, carfentanil, heroin mixed with something. We have no idea what it is.
Tim Reagan, resident agent in charge of the Cincinnati office of the DEA, says 35 agents are working with local police. Reagan says the heroin may have come from a clandestine lab in Mexico or even China, but someone is distributing it to the local street-level dealers.
We're working really hard right now at trying to chase down the source. So if you are the source, you've got DEA's attention, we're coming for you.
Now, the heroin response team program costs money to run, and Dennis Deters says the county will need to come up with that funding to cover the cost. It could cost as much as $100,000 to set it up, and the county is also hoping that the city of Cincinnati will also take part in the program. Reporting live from the Sheriff's Office, Anjanette Levy, Local 12 News. Rob, back to you.
Anjanette, thanks very much. Hamilton County has a tip line where you can report these dealers. It's the number you see on your screen, 352